This year, we received news about Tori Bowie, an Olympic medalist who was found dead in her home from complications of pregnancy. And it is believed that that particular complication was pre-eclampsia. My name is Carolyn Curtis. I'm the CEO and founder of the Carib Company. Tonight, we're going to talk more about pre-eclampsia and eclampsia. Your aunties, your grandmother may know this as toxemia, but this is a very dangerous condition that can occur during pregnancy or in the early postpartum period, meaning up until 6 weeks after you've had your baby. So let's talk about things to be watching out for. We talked earlier about going for a preconception visit and finding out what is your normal blood pressure. It is important to know your normal blood pressure because if there are changes during pregnancy, you at least know where you started from. So if you don't make it to a preconception visit, then what we would do is take a look at what was your first blood pressure on your very first prenatal appointment. Now, there can be changes in pregnancy that can cause changes in the blood pressure. One change is called gestational hypertension, meaning high blood pressure in pregnancy. And this does not happen until after 5 months or 20 weeks of pregnancy. What we will see is an increase in your blood pressure. And if your blood pressure gets to be where the top number is 30 over what your normal blood pressure is, or the bottom number is 15 over what your normal blood pressure is, and that we see that twice, 4 hours apart, then we can say that you have developed hypertension in pregnancy or gestational hypertension. It has no other signs or symptoms other than just the change in your blood pressure. The gold standard for hypertension is the definition of 140 over 90. But I want to alert you that if you have your blood pressure where the top number is 30 above your normal blood pressure, or the bottom number is 15 over your normal blood pressure, then that can also indicate high blood pressure for you. Now, if you start to develop other signs and symptoms, things such as headaches that don't go away when you take pain medication, spots before your eyes where there is flickering of light, or you see stars, or you see floating things across the room, or before your eyes, these are visual changes. And this is a sign of pre-eclampsia. If you start to have swelling in your feet, your hands, or your face, then that can also be indications of pre-eclampsia. I want to take down this picture of Tori so that you can see me. This again would be happening 5 months into pregnancy or 20 weeks after your 20 weeks of pregnancy. These are signs of pre-eclampsia, and you want to make sure that you're seen by your provider as soon as possible. The thing that they will do is to check your blood pressure. They will review with you these signs and symptoms. They will also dipstick your urine. And another indicator for pre-eclampsia is when you're starting to spill protein in the urine. It will be more than just a trace amount, but when you're spilling +2, +3, that is problematic, very problematic. Now, the thing of it is that pre-eclampsia can advance very fast. You can move to a more severe pre-eclampsia where the blood pressure now increases to 160 over 110. And you're starting to spill higher amounts of protein in the urine. This is not something to be played with. With severe pre-eclampsia, the additional sign might be where you're starting to get severe abdominal pain. these are signs and symptoms of pre-eclampsia that can have mild or severe stages. If we're not catching things in time, this can develop into eclampsia. What is the difference between before eclampsia, and eclampsia? Eclampsia is when you begin to start having seizures and you can go into a coma. This is possibly what may have happened to Tori Bowie. Pre-eclampsia can make you very sick very fast. It can also cause you to die. Now, what is the remedy for this? The remedy for this is to be able to deliver your baby. Now, it is very possible, as I mentioned earlier, that you could have gone through pregnancy without any of these signs or symptoms, had your baby, no problem. But it's still possible to have pre-eclampsia up until 6 weeks after you've had your baby. So once you're home, you want to be watchful for any changes in your blood pressure. If you notice swelling, changes in the amount of fluid that you're holding in your face, hands, feet, if you're having headaches that are difficult to get rid of, really bad headaches, spots before the eyes, again, these are signs of preeclampsia in the postpartum period. You do not want to play with this. Contact your provider. This is something for both during pregnancy and after that you would present or should be calling an ambulance for and going to the hospital to be seen in the emergency room. Do not let your provider talk you into waiting. Go in and be seen. So this is information on pre-eclampsia. I wanted to do a special separate segment on this because it's one of those dangerous complications that can happen in pregnancy. So keep all of this in mind, and I hope that you have liked this information. If you have liked the information that you receive on my channel, I ask that you will that you will share this information, and that you will subscribe so that you are notified of other upcoming content that will be provided. Also, get a copy of my free ebook. I will have that information in the description of this video. And be aware, I'm going to be coming out with a coaching program really soon for families who are planning pregnancy or who are already pregnant to help move you through your pregnancy and birth process. So thank you so much for your time. Have a great evening. I will speak to you again. Thank you. Bye-bye.